And if we look at this guy here, for example, who on the face of it also had scoliosis, he held the world record for deadlifting his 5 times or 4 times his body weight. This is not always a big issue, and it's something that we can adapt to over time. So in essence, both of these postures are okay to me. It depends how you get there. Don't focus particularly on technique and allow people to explore their optimum. And what we see from current manual handling training is a focus on technique isn't successful at reducing lower back pain at work. We know from Hignet's work, from Martimo's work, concentrating on technique isn't the way to go. When we look at people in pain then, how do they lift? People in pain lift in a spine-sparing manner. People co-contract more, they brace, they breath hold, there's differences in motor recruitment. People in pain lift in a spine-sparing manner. So why do we teach asymptomatic people to lift like that?